Hi, my name is Katie Price. I am a former educator, and my daughter Eleanor and my son Brandon both attend Odyssey. Both of my kids have asthma, and right now my mom is going through cancer treatment, so our family is also supporting her through that process. So in my family, talking about air quality is not abstract. It's something that we think about every day. And when someone you love is immunocompromised or has asthma, respiratory illness and indoor air pollutants are not small things. What might be just a cold for most kids can mean breathing treatments, missed school, and late night visits to the emergency room for a child with asthma. For families like mine, the quality of air in our classrooms doesn't just affect what happens at school. It affects whether we can safely stay connected and support the vulnerable family members who live with us at home. That's why I support adding clear health-based goals for indoor air to the climate crisis response, climate justice, and sustainable practices policy. 6 to 12 air changes per hour has long been recognized as an effective level of clean airflow for preventing virus transmission in hospitals, with 12 air changes per hour being the gold standard. But achieving that 12 air changes per hour through ventilation from our HVAC systems alone would be expensive and energy intensive. But with new understanding, improved air filtration designs, and updated approaches, reaching that 10 to 12 effective air changes per hour is doable. Pairing a ventilation goal for the HVAC system with an in-room air filtration goal would give the district a flexible framework for achieving excellent air quality. Using the HVAC ventilation together with the in-room air filtration is an incredibly cost-effective and energy-efficient way to provide students and teachers with truly healthy air. And that would mean something real: healthier classrooms, fewer missed days, and more stability for families. For families like mine and many of us here at PPS, this isn't just nice to have. It's the difference between that constant risk and being able to breathe a little easier.
Thank you for your testimony.
Thanks so much.
I forgot to mention, when you just state your name, please, and you'll have spell your last name, and you'll have 2 minutes to speak.
Yes, hello, I'm Dr. Greg Benison. Last name is spelled B like boy, E-N-I-S-O-N. I am a parent of 2 children, 2 students at Robert Gray Middle School, where I'm also the PTA treasurer. By profession, I'm a biochemist and a software engineer. I want to talk today about, to quote some words of Dr. Richard Corsi, who is the Dean of Engineering at my alma mater, which is University of California at Davis. And Dr. Corsi was also, he chaired the National Academy of Sciences consensus report in 2024 on the health risks of exposure to fine particulate matter in indoor air. Dr. Corsi said, to quote, "I do not believe that 4 to 6 air changes per hour in schools is sufficiently aspirational. He has recommended instead for the building of the future should aim for 10 equivalent air changes per hour. And he recommends a way of doing it by using a combination of ventilation from HVAC systems and in-room filtration. When PPS builds new buildings and installs new HVAC systems, a health-based target of 6 effective air changes per hour from the HVAC system is achievable for classrooms, school offices, and similarly sized spaces. The district has essentially achieved this target of 6 air changes per hour in Kelly Elementary School and in the modernization of Franklin. Adding in-room filtration is then an easy, cost-effective, and energy-efficient way to get from 6 to 8, 10, or perhaps even to the gold standard of 12 air changes per hour. So we at Safe Indoor Air for Oregon Schools would like to invite each of you to join us in visiting a PPS classroom where teachers are already getting this high standard of air quality for themselves and their students. Dr. Greathouse has reached out to Directors DePass and Engelsman about visiting one of these classrooms. And there are teachers who would love to host Director Chase Miller as well. Thank you for your time.
Thank you very much. We've got people online. I see Council Member Koyama Lane.
Hi, everyone. Tiffany Koyama Lane for the record. Last name Koyama space Lane. Hello, wonderful board directors, committee members. I'm a mom of both a third grader and a fourth grader, one of who has a chronic respiratory disease. I've also been a public school teacher for almost 2 decades. I'm I'm a PPS teacher currently on political leave, and most recently taught third grade at Sunnyside Environmental School for the past 7 years. Before that, I taught at Fabian School. And like Ms. Price and Dr. Venison, I'm a supporter of safe indoor air for Oregon schools. When teaching my students, I've spent full days in classrooms with low ventilation rates and high temperatures. A lot of these old buildings keep the heat in. These conditions have a direct impact on students. Hot, stuffy classrooms affect their ability to focus. And honestly, it's really hard to get any learning done when it's really hot and stuffy. A lack of clean, fresh air affects really how well they could get through a week, also without absences from illnesses. So I want to speak in support of adding indoor quality goals to the climate and sustainability policy. In Portland, we lead with our values, especially when standards at the federal level or the state level fail to protect health, equity, and our environment. PPS's climate policy reflects our values by setting high goals for reducing our carbon footprint. Healthy indoor air is similar. Minimally acceptable ventilation requirements leave classrooms at 2 or 3 air changes per hour, and such low ventilation rates allow viruses to spread easily and leave too many students and staff without air quality that they need to thrive. So when the district installs new HVAC systems, 6 air changes is a good foundation, and adding air purifiers on top of that push rooms closer to 12. PPS's new buildings like Lincoln and Fabian, where I've taught, have also had some ongoing HVAC problems. Having air purifiers in those newer buildings can give rooms backup with equipment teachers and volunteers can manage when facilities is stretched thin, which happens. Setting these practical targets as board level policy goals help ensure direction across the system while still allowing flexibility in how and when those high goals for healthy airflow are achieved over the coming years. Thank you so much for your time. I really respect and appreciate you all very much. Thank you.
Thank you. We have Julie. Julie, can you say your last name and you can start whenever you're ready.
Hello, my name is Julie Wong, W-A-N-G, she, her pronouns. My son attends Harrison Park Middle School, and he has a physical disability that makes him more vulnerable to viral infections. As you know, PPS just completed a $40 million remodel of Harrison Park and installed brand new HVAC system. And while we feel very fortunate to be in a school that has climate control, the staff and students at the school do not appear to be avoiding illnesses. We don't know how the new HVAC system is because an air quality report has not been provided since the installation of the new system. But a few of the parents have asked for the air purifiers to be turned on in the classrooms. But it appears that the staff are under the impression that the new HVAC system is sufficient and the air purifiers are not needed. We cannot continue to try to remedy this on a school-to-school basis. The students at Harrison Park have siblings who attend other schools with insufficient ventilation and air filtration, and they're passing illnesses to their members of their family. District-wide policy on minimum air changes per hour and air purifier use would make it possible for my son to continue attending school in person safely. Even with updated policies to address indoor air quality infrastructure, we need the adults in charge in classrooms to understand the importance of turning on the air purifiers when the classroom is occupied. My understanding is that the current PAT contract stipulates that the administration cannot dictate certain conditions in classrooms, and air purifier use is one of them. This needs to change. All students deserve to breathe clean air, and their health should not be jeopardized because adults misunderstand the science around indoor air quality. Considering what the district and the wider community is facing, this policy change may seem trivial, but what it boils down to is that sick kids don't learn well, and sick educators impact massive numbers of students. We can implement solutions that make financial and environmental sense by making wise investments. Thank you.